I'm going to be demonstrating the plantar fascia clearing. I've got my patient right here. What you want to do is you can either hop on a stool and raise up the table if you're fancy, or for people who don't have tables that can be adjusted, it's good to set the leg on your leg and have them actually prone as opposed to supine. What we're going to be doing, since the plantar fascia is running, runs along the arch here, and a lot of times that's where the adhesions are going to be. So we're going to start here. You can use it's going to be using a thumb technique, having lotion or some kind of lubricant, or even having some baby powder to eliminate some of whether they have sweaty feet or whether they just got from working out or out of a pool. That might be able to help it glide better as well. You're going to be starting here on the medial aspect just underneath the big toe. You're going to be moving medial along that arch. You're going to go in, starting medial, moving lateral along the arch, and ending medial just at the base of that calcaneus. For our technique here in this project, we're going to be doing this for 3 to 5 minutes. You can also move them into various positions depending on how stiff they are or how loose they are. So if I wanted to move the patient because they're not getting the effects that I want with them just relaxed, I can move them into that plantar, more of that dorsiflexion, and then do the clearing technique once more. Or if that's too sensitive, you can have them go into that plantar flexion and even going into curling the toe and then moving the thumb medial, from medial to lateral and back to medial again.
Okay, so the next technique we're going to do is going to kind of help increase your ankle range of motion since you haven't been doing anything to kind of help with that. So a lot of the times after you sprain your ankle, this bone here, it's called the fibula, it can kind of slide forward and down, so it'll prevent your ankle from coming up all the way. So we really want to make sure that we can get your ankle up all the way without any pain, okay? So what we're going to do is I'm going to have you just basically go into a lunge position, and I'm going to hold on to that and kind of just pin that back so we can kind of make sure it stays in place so that you can clear that and kind of go through your full range of motion. Okay? Sound good? Okay, a couple of things. If you have pain at all, let me know. It shouldn't be painful at all. I'm going to have you just go ahead and stand up for me, and I'm going to show you what you're going to do. So we're going to have your right foot forward, and then what you're going to do is you're just going to lunge forward as far as you can until you start feeling that restriction or pain. Okay, go ahead. Hold on a sec. And then once you get to that position, I'm going to have you hold for like 1,000, 2,000, and then come back. Okay, and you're going to go in, 1,000, 2,000. Make sure your knee stays over your toe, that it doesn't come in like that at all. Make sure it stays there, nice and straight. Okay, sound good?
Yep.
Okay, so we're going to go ahead and do 6 reps, all right? So just go in as far as you can until you start feeling restriction or pain. Okay, back, good. Good. Doing okay?
Yes.
Okay, 2 more.
All right.
1 more. All right.
The next manual therapy technique we're going to be doing is a cuboid mobilization from the surface of the plantar aspect of the foot dorsally. A lot of times with dorsiflexion, we tend to focus on the talus only, the talus and the tibia. But in decreased dorsiflexion of those who even have good movement at the talus and the tibia actually have adhesions or have poor movement at the cuboid. So what this is going to do, we're going to move it plantarly to dorsally to increase dorsiflexion. You could do this for an amount of sets between 10 and 20 reps for a couple of minutes or to the patient comfort. So I'm going to go ahead and demonstrate this right now on my patient. So the cuboid is medially, so you're going to locate the cuboid right here, which on my patient is right about here. You're going to go inferior, so now you're going to go to the dorsal aspect and you're going to feel that cuboid underneath. What I like to do is I like to have, I'm going to press it in with my left hand and I'm going to use my palm to reinforce. And I'm just going to provide that dorsal, the plantar to dorsal force. Again, my thumb is right here on the cuboid. I lost it for a second there. There we go. You're on the cuboid, and then my palm's going to be over, reinforcing that. You can also move them into their end range motion. So if they have only this much dorsiflexion, you'll again find that cuboid. Place your hand over it, and then do oscillations into from plantar to dorsally.
Hello, I'm Ryan Koenig, and I'm with Indiana State's Doctorate in Athletic Training Program. And today I'm at Neyland's Field in Tennessee, and today I'm going to be discussing the first metatarsal joint mobilization. So for this specific mobilization, I'm utilizing the first digit or the first metacarpal joint. What we're doing is we're trying to assess and improve great toe extension. So for right now, I'm going to show passive extension. So she has pretty good motion. And so what I'm going to be doing is I'm going to be grasping at both the proximal and distal head, the distal head of the first metatarsal, and then I'm grabbing the head of that proximal first phalanx. So what I'm going to be doing is I'm going to be having my right hand as the mobilization arm and my left hand as the stationary arm. And what I'm going to be doing is I'm going to give a dorsal, or I guess if you're looking at it this way, an anterior force while keeping my left hand stationary. So I can do it in the neutral position, so at that flat angle here, and then to really get that extension, have them in extension and do the exact same mobilization. So passively extend that toe while still grasping those heads, and then going through that dorsal mobilization. So you can do this set for about 20 reps, or you can even do it for a time span of about 15 seconds. Then at the end you relax, and then you can reassess that great toe extension. So that was a pretty good improvement. And that's the first metatarsal joint mobilization.
This is a demonstration of the home exercise program, Gastroc Stretch with Self-Posterior Talar Mobilization. To complete this, you will need a non-elastic strap and a small object to prop the foot on. To begin, the patient will need to stand in a split leg stance with the unaffected leg behind. The strap needs to go over the malleoli and over the anterior portion of the foot. The patient is going to prop the affected leg on there and going to lean forward onto it while giving a pull with the opposite leg to perform the glide and the stretch at the same time. To complete this, in a bent knee position, it will be the exact same positioning, only the patient will use a bent knee on the front leg while they lean into the stretch.